So placenta accreta is an abnormal placenta, right? So when it attaches to the uterine wall, there can be some risk factors that we're seeing more and more of, right? If you've had a previous cesarean section, or if that placenta then implants there, it can be called a placenta previa. So in women that have had a previous cesarean section and then get diagnosed with a placenta previa, meaning that the placenta overlies kind of the exit area of the womb, that can be a risk factor.
And I would add to what you touched on already, you and I are about 30 years apart from our fellowship training. And back in the 60s, and that was a little bit before my time, the cesarean section rate was somewhere around 6 or 7%. And now the C-section rate, for a variety of different reasons, is somewhere between 32 and 33%. So we're doing a whole lot more C-section, therefore we have somewhat of an epidemic of placenta accreta because so many C-sections are done, and that seems to be one of the strongest risk factors for developing this abnormal growth of the placenta into the uterus.
Yeah, and so with that, with each subsequent C-section, that risk increases for there to be a previa and there to be an abnormal placenta. And when we think about that, that placenta can grow through that previous scar defect of where they had their C-section. And when we think about that, it can actually go through the muscle of the uterus or the womb, and also then to the bladder or other surrounding organs such as bowel vessels. So these can be more complicated and riskier surgeries.
And those surgeries are truly potential emergencies. These placentas can get very aggressive and grow into blood vessels and be involved with a significant amount of blood loss. But the importance of that is that we need to have a multidisciplinary team of a group of people that are capable of taking care of this.
And we're set up to have that. We already have anesthesia, our NICU, our blood bank, surgical specialists or subspecialists, even if we need those, here with maternal fetal medicine and our obstetrical providers as well. And so by coming together and putting all of our resources together, we can best take care of these patients. And so just like you said, not only here in the Baton Rouge area, but to try to allow access for women across the state and across state lines to be able to come and have care here with us. And this is near and dear to my heart. This is truly one of my interests in surgical expertise. In my fellowship training, got to do many cases, approximately 15 to 20 a year. And so when you think about that, just having a team that's able to do a lot of these cases, not only are you going to help improve that woman's life and outcomes, but be able to just provide even more resources for the entire state.